Here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So we've heard all these different studies. We wash our hands too much. We wash our hands too little. What is the proper, I guess, amount of times that we wash our hands during the day?
I mean, it just kind of depends on what you're doing. I mean, for me as a physician, we should be doing it each time we interact with a patient, examine a patient. We should be sanitizing our hands when we go into the office as well as when we leave. Sometimes that is difficult, and physicians, nurses, anybody who interacts with a patient for that matter has to work on that because it can be cumbersome wiping your hands all day. Sometimes the material we use is very irritating. Your hands can get chapped, painful, very dry, flaky, and that can be a little bit irritating. So if this type of handshake, if you will, works better, bump, yes, is more sanitary, then I think it's a good idea. But certainly it's not going to get in the way of spreading organisms and infections, especially in a hospital setting or in the medical profession for that matter. There's several things that can be done. That is one of them, doing a fist bump instead of a handshake. I think I'm very traditional, and you like to have a good relationship with your patient. They want to feel comfortable. A handshake goes a long way in solidifying that.
Especially in Texas. Maybe it's just a southern thing.
Absolutely. So it's certainly something to think about, and maybe something that can be tried. But again, it's not going to solve all of our issues. It's one thing among 4 or 5 things that we can do to decrease the potential spread of an organism. But organisms always find a way depending on what we do. So just try to be as sanitary as possible. We cannot live in a bubble. We have to live and do what we can. So don't be too afraid. But if you want a fist bump, that's fine.
I can't imagine going on that first job interview and fist bumping. There's just something wrong with that.
I don't think they're going to call you back.
Yeah, I don't think so.
Yeah.
Our first question, can you recommend a good doctor for back issues? This person has been in pain for a lot of days. They have a herniated disc.
Herniated discs normally are a part of degenerative joint disease or low back pain, chronic back pain. We normally start off with pain doctors, actually, because a lot of times they can help alleviate a lot of the discomfort that comes along with the degenerative joint disease. If you need surgery, here locally we use neurosurgeons. They normally perform those procedures, but a small percentage of patients actually need surgery. Most of the time this is non-surgical approach, so the pain doctors is normally who we start off with. Chiropractors can be a good person to go and talk to. They have maneuvers and other sorts of modalities to help with the back pain. Also, by yourself, weight loss, if you're smoking, don't smoke, as well as back exercises, which can be picked up on Google or on the internet, some things you can do to help relieve some of that back pain.
Okay, another question. I read that drinking iodine can heal anything. Is it true?
No.
Easy enough.
Yeah.
What makes your hand feel like it's on fire?
I mean, it's probably our old friend neuropathy that's rearing its ugly head. I mean, a lot of times neuropathy from pinched nerve in the wrist or the neck. Diabetes, medications, poor circulation. So just get into your physician or healthcare professional's office to get a proper workup.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. We've got an 86-year-old man. He has arthritis in the neck, lower back pain, goes away during the day, but in the morning it hurts. He wants to know, could it be his kidneys?
I don't think so. I actually get this a lot. I had a patient in the office this morning, same sort of complaint, that the kidneys are in the lower part of your back, but typically do not cause pain. It is normally going to be degenerative joint disease of that lower back. Kidney pain, a lot of times from a kidney stone possibly. Even with a large kidney cancer or kidney mass, most people don't have much pain. So a lot of times kidney pain is a misnomer. It's normally going to be back pain from arthritis causing that.
So what can you do? We hear a lot of times people having that low back pain. How can you avoid it? What can you do to help it?
Really, the biggest thing, we talk about it all the time, is to keep your weight down, because unfortunately as we gain weight, our body chemistry changes. It tends to produce constant inflammation, and because you're overweight, it puts more strain on the back. It doesn't have time to heal, and with the chronic inflammation, it causes degenerative disease in the joints. Herniated disc, bone spurs, then that causes irritation with the nerves, and then that's when you start getting the cramping and the aching, and when you pick up something heavy. So the big thing is to keep your weight down. Certainly don't smoke. In my experience as a physician in this area, smokers tend to have a lot more back pain a lot sooner in their life. 20s, 30s-year-old coming in with severe back pain, they tend to be smokers.
Okay, another question. A 52-year-old female diagnosed with carpal tunnel, and she has a knot on her wrist. Would carpal tunnel cause the knot?
I don't think so. In my experience, the knot could be from something degenerative or arthritic. It could be potentially causing the compression on the nerve, mimicking carpal tunnel, but I don't think carpal tunnel is causing the knot per se. Certainly we can figure that out with x-rays such as MRI as well as physical examination.
Okay, a 65-year-old male gets headaches and hot flashes at the same time, wondering what the cause is.
I mean, that's a tough one in 65. If this person was female, that would be very easy.
Right, but it's male.
No, at 65, I probably would have to do some blood work. I'd have to look at their medications because a lot of times medicines have side effects such as this. Anytime at the age of 65, any complaint, is it related to malignancy? That's always going to be a concern. So I probably would do some CAT scans of the chest or abdomen, the urine, the bladder, making sure nothing is popping up. But at this point in time, very broad presentation symptoms, so would probably need a lot of workup. Could be a lot of different things.
Okay. A 34-year-old female has numbness in her left arm and leg. What could be causing the numbness? I
probably would think of a pinched nerve actually in the neck area. Certainly MRI could pick up on that. That might be a surgical indication. That's something we would send to the pain doctor first. Anytime you have neurological symptoms that don't go away, that's severe, that causes weakness, we're looking probably for surgery, and we go directly to the MRI to take a look at the spine.
So we're talking neurosurgeon again.
Neurosurgeon. Here in this area, there are some orthopedists, but not in this area, but here locally, it's neurosurgeons.
All right, Dr. Levine, as always, we appreciate you stopping by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.